Video is for nurse leaders. A nurse leader is any registered nurse who already has a bachelor's or higher level of education and is willing to lead an RN to BSN student from Rogers State University in a clinical setting. RSU has several requirements for their BSN students. The first one we will discuss is appropriate dress. A BSN student must be dressed professionally with a white lab jacket or lab coat and the RSU name tag. Here's an example of that.
Perfect name tag here. My name's Kyle. Alright. And then underneath I do have a professional dress, such as the formal shirt and the tie. Okay.
Inappropriate dress can include a lab jacket, but denims are never appropriate in the clinical setting. Neither are flip-flops or the name badge of a different student. Other inappropriate dress can include a wrinkled lab jacket, lack of name tag, or lack of professional dress underneath said lab jacket. There are a few situations when a different dress may be mandated. For example, the registered nurse following a different BSN nurse at a campground setting. Here's an example of appropriate dress to do a day of camp. Appropriate dress should be decided upon ahead of time, depending on the setting, whether it is hospital or out in the community or the field. Thank you very much. A time should be set between the nurse leader and the student nurse ahead of time. Sometimes this scheduling needs to take place through education if it's in a hospital setting with appropriate paperwork completed. The appropriate packet or paperwork that the BSN student should have available upon request includes a copy of immunization statement and waiver, copy of RSU student immunization record, copy of front and back of the CPR card healthcare provider, copy of the RSU student ID card, copy of background and OSBI reports, and copy of drug test results. The student can keep that packet on them and provide it for the nurse leader if requested. The student will also have a nurse leader evaluation form for the registered nurse with a BSN or higher level of education to fill out at the end of the student's day. In settings that require nursing care, the nurse leader can determine the level and participation of the student. Therefore, the student may participate in skills and nursing care that the nurse leader feels are appropriate and that the student nurse is comfortable with as well. The BSN student will provide the nurse leader with a small packet of information. The first 2 pages just give a general idea of what the student's day should look like and their course and field objectives. The next page will be filled out by the nurse leader and signed. And there are 2 different pages for the nurse leader to fill out and sign. The final page is an evaluation form on the BSN student. At the end of the day, the nurse leader should fill out the evaluation form and place it in an envelope that is provided by the BSN student. Seal the envelope and then sign over the sealed envelope. This envelope will be returned by the BSN student to their instructor.